Hi. 18 to 22 weeks anomaly scan. Why, when, and how? 90% of the cases after the anomaly scan, the report is going to be normal. So, all good. So, it helps in reassuring the pregnant woman and the couple and helps in the bonding of the couple with the fetus. It helps us also to rule out major congenital anomaly. It helps us to rule out minor congenital anomaly. It helps us to detect the presence of soft marker, which will lead us to the detection or investigation for chromosomal abnormality. We have an opportunity to evaluate placenta, umbilical cord, and amniotic fluid during this scan. Also, we look at the fetal growth parameters so as to compare in future and diagnose fetal growth restriction. Also, it we can look at the cervical length, which will help us in future comparison of the cervical length, and if there is shortening, we can predict premature birth. We also have a look at uterine artery PI index, which will tell us there is risk of preeclampsia development in this pregnancy. Now let us consider when. Anomaly scan friends should be ideally done between 18 and 22 weeks of pregnancy. Why not before 18 weeks of pregnancy? Because the fetus is small, the structures are in the stage of development, and therefore there are more chances that the anomaly will be missed if we do it before 18 weeks of pregnancy. Why not after 22 weeks of pregnancy? Because if an anomaly is detected, then we may like to reconfirm it, we may like to take a second opinion, we may have a multidisciplinary team approach, counseling sessions, and decision making, and all these, my friends, are going to take a few days, and therefore the decision and the ultimate management should not extend beyond 24 weeks of pregnancy, which is the current limit of legal limit of medical termination of pregnancy in India. Let us see how it is done. First, we have to complete the government rules formalities regarding this scan. Then, the patient is taken to a room which is dimly lit so that the structure visualization is better on the sonography machine. The required part of the patient's abdomen is exposed. A tissue paper is stuck under the clothing so that the clothing don't get soiled with gel. Gel is applied on the patient's abdomen skin. This gel is a medium to provide better contact of the probe onto the patient's abdomen for better visualization of structures. Then the sonographer moves a handheld device, what we called as a probe or a transducer, on the patient's abdominal skin, and we look at the various structures of the fetus. The image may be visible to the patient on a TV monitor screen. Required measurements are taken, images are saved, and a report is generated. It may take friends about 30 minutes or so for this entire scan to get completed, but it will depend upon the position of the fetus and visibility of all the structures to the satisfaction of the sonographer doctor. For example, fetal spine is better seen when the fetus is prone, that is the tummy down, whereas fetal face will be better seen when the fetus is in prone position with the face facing up and the spine facing down. Friends, a sort of a checklist is followed and a methodical approach is taken so that we don't forget or we don't miss out looking at any particular structure to not to miss out any anomaly. For this, ISUOG recommends six-step approach, looking at the lie, the presentation, the viability, the number of the fetuses, etc. ISOG also recommends 20 plus 2 planes approach to cover and look at all the structures of the fetus. FMF, that is Fetal Medical Foundation, recommends 18 views for the same purpose, not to miss out anything. All the images are recorded, report and films are generated, and then an opportunity is provided to the couple to have a counseling session or a discussion with the sonographer doctor.